The leg has got three compartments: anterior compartment, lateral compartment, and the posterior compartment. You already have some idea how these compartments are being formed. There is a deep fascia which is continuous from the anterior border of the tibia to the posterior border of the tibia, and it is been divided on lateral side by anterior and posterior intermuscular septum. So we have come across the anterior compartment where we got the tibialis anterior and all the extensor group of muscle like extensor hallucis, extensor digitorum, peroneus tarsus. On the lateral compartment we got the peroneus longus and peroneus brevis. Now in the posterior compartment, it is been divided into three sub-compartments. The diagram will clearly give you a conception of different sub-compartments. In the posterior compartment, we get a bulge, muscular bulge. Also we call it as a cuff muscle, which is being contributed by the gastrocnemius muscle and the soleus muscle as a whole, which we can feel this cuff muscles, which is being contributed by gastrocnemius and soleus. Yesterday we have seen gastrocnemius muscle. It has got two heads, medial head and lateral head, which forms the boundary of the popliteal fossa. Okay, and deep to the gastrocnemius we will get another muscle which has got a sole shaped, which is pattern, that is the soleus. Now in this picture we can see this is the tibia, okay, and this is the fibula. This is anterior aspect, this is the posterior aspect. So we know this is the deep fascia, starts from the anterior border, it surrounds the leg and ends in the posterior border. So, and here it is the interosseous membrane in between the tibia and the fibula. So here in front we are getting the anterior compartment. We are not concerned with this one today. We are getting the lateral compartment, which is being contributed by this deep fascia and anterior intermuscular septum and posterior intermuscular septum. Here we are getting the peroneal group of muscle. We are not concerned with this compartment. So we are concerned with this compartment, that is the back of the leg. And here it is posteriorly, it is been contributed by this deep fascia of the leg, and in front by the posterior intermuscular septum, part of the fibula, then interosseous membrane, then part of the tibia, okay, the fibula, related to fibula and attached to the fibula. And this muscle is nothing but, and this is flexure hallucis. If you consider it as a foot, this is the great toe and these are the other digits. Okay. Great toe is medially and rest of the digits are laterally. So we should expect the tendon which will be going to get attached to the great toe should be medial, and the tendons which are going to the lateral four ones, they should be on the lateral side. But here we can see the reverse. It is present on the lateral side. This tendon, it is the flexor hallucis longus. Okay. It will go towards the medial side, and this will go to the lateral side. So there will be crossing of the tendons below in the foot. Why it is so? Why it is so? Why nature has done this peculiarity? The tendon, the flexor hallucis longus, is laterally placed, and it will go towards the medial side. And flexor digitorum muscle is placed on medial side. It is going to the lateral side. So here it has to cross like this, from medial to lateral, lateral to medial. And this crossing is like this, that flexor digitorum remains superficial and flexor hallucis remains in a deeper plane, and there is a crossing in the sole. TBI has got, which bone is heavy and bulkier? Tibia. Which bone is slender? The fibula. For fibula, it should be one muscle, and for the digitorum, it should be that there should be a voluminous space. So it is placed on that side. But there is another paradox. The muscle bulk of the flexor digitorum longus is slender than that of flexor hallucis longus. Continuously there is a paradox. Just opposite. For single digit, that means for the great toe, the muscle bulk should be very thin, because flexion of the great toe needs more energy, and it is, we know this is the great, this is a thumb and the great toe, they are very important, for which we are human being. We know there are so many movements we can grasp, by which we can apprehend, which can grasp. Nature has, we are in the top of the phylogenetic tree because of the fact we have got this thumb, a pollex. Similarly, this great toe has also got very importance for anchoring. When you are moving over the slippery area, you can see the great toe is doing much more function. Other toes are functioning, okay, and it has got so many movements, okay. That means abduction, adduction, flexion, extension, free movements. So for that, nature has provided bulkier muscle. So in the intermediate compartment, you can find on the lateral side, that is the flexor hallucis longus, and medial side, that is the flexor digitorum longus. And in the innermost plane, we are getting only one muscle, that is tibialis posterior. This is a unique muscle. Looks like a feather. In the feather, you are getting so many fibers, and there is one tendon-like structure. Here we will get, okay, unipinnate muscle. Unipinnate muscle. That means there is one feather and there is a tendon and fibers are directed around one side of it. So in the deeper plane, we are getting this muscle. So, and in between the superficial and deeper plane, we are getting one artery, one nerve. They are continuation of tibial nerve and posterior tibial vessels. And on the lateral side, towards the fibula, fibula has got this border. This is called medial crest. Here we are getting another artery, which is nothing but the branch from this artery. There is a posterior tibial artery, which is called the peroneal artery. This peroneal artery sometimes becomes, the caliber of the artery becomes more than the caliber of the posterior tibial artery. Baby becomes fatter than mother. Okay. So these are the neurovascular structures. That means vessels and nerves. We are getting in the intermediate plane. And most in the superficial plane, that is just below the skin, we have already seen this sural nerve and small saphenous vein. So this is the course of the small saphenous vein. We have seen coming from the lateral side of the foot with continuation of the lateral part of the dorsal venous arch, and it is accompanied with another nerve on the lateral side, that is the sural nerve, which is coming from the tibial nerve. But unfortunately or fortunately, this saphenous nerve, we cannot find the saphenous nerve here in this body, where a branch from the common peroneal nerve replaces this whole nerve. Okay. There is an anomaly in this body. Generally, this sural nerve is coming from the tibial nerve, but here the sural communicating nerve, which is coming from the common peroneal nerve, it replaces the sural nerve. There are other nerves we can find. Okay. So posterior compartment, superficial, middle and deep parts. Okay. Now this is a very interesting thing. We will find in between the calcaneum and this is the medial malleolus, and here we can find thickening of the deep fascia. On the medial side, we know this is medial malleolus. The medial malleolus is connected with this calcaneum. Okay. With this, what is PA? Whether the leg is PA or the foot. It has got dorsum. So pedicure, manicure, it is very common nowadays. Pedicure, that means foot, PA. Okay. I am not going detail of it, but so this is the entry point to the foot. So many structures they are destined to reach the foot or the plantar side. So this is called porta pedis. I have cut, today I did the dissection, when I did the dissection I cut this flexure retinaculum to open these structures. From medial to lateral, they are Tom, Dick and nervous Harry. And in Bengali, there is one mnemonic, that is টিকটিকির ডিম ভেঙে আমি ভীষণ নাকাল হয়েছি। টিকটিকির ডিম ভাঙলে তো ভীষণ নাকাল হতেই হবে, তাই না? সো টিকটিকির ডিম ভেঙে আমি ভীষণ নাকাল হয়েছি, and Tom, Dick and nervous Harry. How? Most medially tibial is posterior. টিকটিকির ডিম, Tom. টিকটিকির ডিম or Tom? Tom. Tibial is posterior. Next, dim, Dick, flexure digitorum longus. Dim or Dick, that is flexure digitorum longus. So most medially tibial is posterior, Tom or tiktiki. Then dim or Dick, that is flexure digitorum longus. Then and means artery, posterior tibial artery, along with there are vena comitatus. There are two veins are moving on either side of this artery. In Bengali, টিকটিকির ডিম ভেঙে আমি ভীষণ, vein, artery, vein. Okay. Then nakal, that is the posterior tibial nerve or nervous. Tom, Dick and nervous Harry. Nervous. Harry is nervous. So Harry. Then ultimately the Harry হয়েছি, that is the flexure hallucis longus. So tendon of the flexure hallucis longus. So these are the structures passes through this port. So this port is actually nothing but the flexure retinaculum. We have opened that one to show this structure from medial to lateral. They are tibial is posterior, tendon of the tibia is posterior. Then tendon of flexure digitorum longus. Then posterior tibial vessels. Vessels means vein and artery. Then tibial nerve or posterior tibial nerve, same thing. Somewhere it is written as posterior tibial nerve. Okay. সুরে সুর মিলাবার জন্য posterior tibial vessels, posterior tibial nerve. পাওয়া একই জিনিস, tibial nerve. And tendon of flexure hallucis longus. Both this flexure digitorum and flexure hallucis, they are coming from a distant place. So they are flexure digitorum longus, flexure hallucis longus, because there are some counterpart are small muscles in the sole. Okay, counterpart. Flexure digitorum brevis, flexure hallucis brevis, there are so many muscles. So they are the flexure hallucis longus and flexure digitorum longus. Okay. So diagrammatic representation, you can see this tibial is posterior, it is coming and is getting attached to this bone. This is called the tuberosity of the navicular bone. This tibialis posterior is very unique regarding its attachment. It is primarily attached to the tuberosity of the navicular bone. But from here, there are some expansions. Those expansions are going to all the tarsal bones, underneath of the tarsal bones, except talus. And the expansions are also going to the undersurface of the base of the metatarsals, except the first metatarsal. This is very unique. the tibial is posterior. And others, like we can see flexure digitorum longus, this crosses superficially this flexure hallucis longus and it is going lateral side. And whereas the flexure hallucis longus, it is going to get its attachment to the distal phalanx, underneath of the distal phalanx. Okay. And also we get this artery, which posterior tibial artery, which divides into two branches, lateral and medial branches. Medial and lateral plantar arteries. Plantar aspect means the sole. So this posterior tibial vessels divides into medial and lateral plantar arteries. Similarly, this nerve is again, you can see the nerve, that is the tibial nerve, is ultimately dividing into two pieces. Terminal division, that is medial and lateral plantar nerves. And we have seen gastrocnemius, we have seen soleus, we have seen plantaris. Here you can see the plantaris muscle, you can see the popliteus muscle, we have dissected nicely. We have seen flexor digitorum longus, flexor hallucis longus and tibialis posterior. Now this is the picture of the gastrocnemius. You can see there are two heads. Okay, we can see. So there are two heads. Okay. So this is the gastrocnemius muscle. If it is adductor tubercle, okay, so this should be the medial head. Okay, medial head, okay, like this. It is going, and where it is attached, it forms a tendon which is called the two heads joins to form this single tendon. The muscle is fleshy here, it becomes tendon and it is attached to the middle of the posterior surface of the calcaneum. What is the innervation? In between superficial and deep muscles, we are getting tibial nerve. So tibial nerve will give supply to all these muscles of the leg. Okay. So innervation is very much apparent. So this is the gastrocnemius on this side, and below the gastrocnemius we are getting a soleus which looks like a sole, and these two muscles, they forms a single tendon which is called the tendocalcaneus or tendoachilles. Okay, and it is, this soleus is taking origin from the soleal line of the tibia and also from the fibula. Okay, it's a horseshoe shaped origin. Okay, Greek mythology. Okay, you can read it. So this is very important. This is the Achilles tendonitis. It is very much common. Actually, there is a bursa which is separating this tendon with the bone. Bursa means a synovial fluid filled some sac. Nature has provided in between bones and the tendon. If we use it constantly, then what will happen? That bursa will get inflamed. You will get inflamed. Inflamed means, what is inflammation? You will know it in pathology. Inflammation is itis. Itis means inflammation. That means in Bengali it is called gha. In English it is called inflammation. There is pain, tenderness, swelling. So these are the features. So And Achilles tendon is sometimes ruptured. In clinical practice, we will find person will give history that when the person went to the toilet and suddenly the leg entered into the gap and there is sudden tear. And tendon has poor blood supply, so it will take long time to heal. Okay. So this is a jerk which is called ankle jerk. You can see the hammer we can see one hammer and the tendon is tapped with that hammer. So there will be jerk which is called ankle jerk. It is very important in medicine. Okay, the segments are S1, S2 segments of the spinal cord. There are many jerks. There is a patellar tap. When the person is sitting, hanging, and the leg is hanging, if the tendon, patellar tendon is tapped with the hammer, there will be a jerk. Pendular jerk is seen in pendular jerk. I am giving you the question, you will give me the answer. Pendular jerk, there is one pathology, it is related to cerebellum, pendular jerk, knee jerk. The soleus, the same thing, the soleus muscle you can see, superficial one is the gastrocnemius, below we are getting the soleus. And also we can see the origin of the plantaris from lateral side and it is going medial side of the tendon of the tendocalcaneus. From lateral side it is moving. It looks like the tail of a rat. And many a times this muscle is absent. At least in 10% of the population, you will not get this muscle. Okay. And one may mistake as a nerve also. The freshers can miss it as a nerve. So this is called Fresherman syndrome. Okay. Now this soleus is very important. Soleus is also called the peripheral heart because there is a connection between superficial vein. From the superficial vein, it goes to the deep vein. And there is a venous channel over the soleus muscle. And when we are walking, the soleus pumps. And the blood from that area, it enters into the more deeper layer. Deeper veins, that means in the popliteal veins. So, due to its contraction of this muscle, there is flow of blood to the deeper plane. So, it is called the peripheral heart and it comes as a short note, peripheral heart. You will not get soleus. Short note, peripheral heart. Soleus is the peripheral heart. You can see the compression of vein, it enters into the deep veins. Okay. Soleal tear, soleal pain, plantaris. Plantaris is absent, you can see it is absent in 10% of cases. Okay. With Fresherman's syndrome. Young surgeon, young anatomist may mistake as a nerve. It is taking origin from the lateral side and going medial to medial side of the Achilles tendon. Okay. Sometimes the muscle bulk is absent, only the thin tendon is present. And this tendon is also used in different grafting. This plantaris tendon, because this muscle is hardly needed. Okay, it causes weak plantar flexion All this, that tendoachilles acts as a plantar flexion. So this also acts along with it, the weak plantar flexion. And this tendon is continued as a deep fascia in the sole, which is called plantar fascia. So it is said the plantar fascia is nothing but the continued part of the plantaris tendon. Okay. This muscle we are getting in the popliteal fossa, in a deeper plane, above the soleal line. This is the soleal line from where the soleus takes origin, above, triangular muscle, okay, and it causes the unlocking of the knee joint. During walking, there is locking and unlocking. Unlocking, again locking. During unlocking, there is movement of the lateral condyle of the femur over the tibia. So it causes that movement and it becomes free and there is unlocking. So this plantaris muscle is called unlocking muscle. Okay, and it is being supplied by the tibial nerve, and a branch from the tibial nerve, it enters, it hooks below the plantaris muscle and it gets the supply from a deeper plane. Now we are getting flexor digitorum longus, we can see it taking origin from the tibia. This is a tibia, this is a fibula, in between we are getting the interosseous membrane. So this is the area from where upper two-thirds of the posterior surface of the tibia we are getting this flexor digitorum longus, and we are getting this divides into 1, 2, 3, 4 tendons which are going to the lateral 4 digits. It causes flexion. Okay. And it maintains the longitudinal arch of the foot. As it is contracting, so we are getting this longitudinal arch of the foot. Okay. There is a longitudinal arch. So that is being produced by this. So these are the tendons we can find. This is the area of origin and these are the tendons. Now we are getting in a deeper plane, that is the tibialis posterior, and from the tibialis posterior, okay, we can see so many expansions. And this is on the lateral side, this is a flexor hallucis longus. It is going to the great toe and it is going under surface of the distal phalanx of the great toe. So this is flexor digitorum, this tibialis posterior in between. On the medial side, this is the flexor digitorum. On the lateral side, this is the flexor hallucis, and in between we are getting the tibialis posterior. So this is the picture of flexor hallucis longus. From the fibula is a posterior, this is the posterior view of tibia, fibula and the sole of the bones of the sole. Okay. So it is this flexor hallucis longus is going to the terminal phalanx. Now this is the tibialis posterior. You can see one tendon, okay, unipinnate muscle, and around it we can get the muscle fibers. You can see it here in the cadaver nicely. Now the vessels, about the vessels, posterior tibial vessel which divide, which is continued like this. From here one branch comes out which is called the peroneal artery, okay, which is related to the fibula, or more precisely to the medial tubercle of the fibula, okay. And sometimes this artery is the caliber of the artery is more than the caliber of this artery. This is the branch from the posterior tibial vessel. You can see this is the popliteal artery which divides into anterior tibial and posterior tibial. Here is a gap in between the interosseous membrane and the neck of the fibula, from where this anterior tibial artery moves. And from here we are getting the posterior tibial artery which divides in peroneal, and this is the continuation of the posterior tibial vessels which divides into medial and lateral plantar arteries, okay. It divides into medial and lateral plantar arteries, and it gives so many branches, medial malleolar branch, the calcaneal branch, these are all the branches, okay. There is an anastomosis around the ankle, that is not much for you, needed for you, okay. You can feel the pulse, posterior tibial pulse in between the tendocalcaneus and the medial malleolus. If you press, you can feel the pulsation, that is the pulsation of the posterior tibial artery. You can see that nerve and the artery. The nerve first remains on the medial side, okay, because it crosses in the, actually nerve was on the lateral side, tibial nerve, it crosses in the popliteal fossa, it becomes medial. Again it, in the lower part of the leg, it becomes on the, it resides on the lateral side of the artery, and it divides into medial and lateral plantar nerves, okay. So many branches are coming from the tibial nerve, plantaris, lateral head, medial head of the gastrocnemius, okay, genicular branches, soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, sural nerve, medial and lateral plantar nerves. Tarsal tunnel syndrome, here we are getting carpal tunnel syndrome. Similarly, here we can get the tarsal tunnel syndrome. Here there will be compression of the tibial nerve. Thank you. Now see the structures there.